We begin with National Drive in a Circle and Honk Day. Today was National Drive in a Circle and Honk Day, as proclaimed by Americans for Prosperity. They're the corporate-funded fake grassroots group headed by a longtime Republican political operative named Tim Phillips, who you see here. You might also recognize Mr. Phillips because he's been a guest on this show a few times. That's because Americans for Prosperity has organized a lot of the opposition to health reform. They are the big bloody handprint people, for example, who you might remember from their bus tour with the speaker who said health reform was like Pol Pot and the Nazi Holocaust, all in one. So that strategy didn't work. Health reform does look due to pass shortly. And so now Tim Phillips' anti-health reform group has resorted to today's national directive to drive around in a circle and honk. Next year's protest? Scratching your nails on a chalkboard to protest cap and trade. Health reform is about to pass, which, for all the clamor about it, is a huge political victory for the Democratic Party. In one way or another, presidents have been trying since World War II for health reform. While generation after generation, the system has just become more and more unsustainable. Health costs now rising to the point where they account for $1 in every $6 spent in our economy. That's dollars spent on anything. But no one's been able to try to really do anything to fix this problem. Nobody's been able to get this close to fixing the problem until now. Passing health reform is going to be a landmark moment for the Democratic Party. And so, say it with me now, everybody freak out! Those opposed to Democrats pulling off this political feat drove around in circles and honked today. They also held a tea party on Capitol Hill, though only a few hundred people showed up. What that event lacked in numbers, they made up for in exclamation points.
I don't want to make you sick, but I brought an abortion to show you today. There's a whole lot of demons going on. There's a lot of demons around here, apparently.
Congressman Louis Gohmert of Texas. Unclear, to be fair, if the demons are the same as the abortion he says he brought with him, or if the demons are a separate matter from the abortion he says he brought with him. Unclear. Unclear but emphatic, which is the way to understand what is happening to the opposition to health reform now. Today at National Republican Congressional Committee headquarters, Republican leaders gathered to promote their Red Alert campaign to try to re-energize the opposition to health reform.
We want Americans to go to Code Red. Understand that we've got to put all the pressure we can on these wavering Democrats to make sure that this bill never, ever, ever happens.
Go to Code Red. Here's the problem with the Code Red strategy. Even as Republicans are calling for pressure on Democrats to vote no on health reform, since they've locked up all the Republican votes already, Republicans at the same time are admitting that even if any Democrats do what they say and vote no on health reform, Republicans are still promising to attack those Democrats on health reform. So in other words, there's no incentive at all, no reason at all for any Democrats to go along with Republican efforts to get them to vote no on health reform. Either way, Republicans are promising to still attack them. Democrats' only choice on this issue is whether they'd like a record of historic achievement to stand on when responding to those inevitable attacks. Joining us now is New York Congressman Anthony Weiner. Congressman, thanks for coming by. Nice to see you.
My pleasure. Thanks.
The LA Times today had a story. They say for people who are under the age of 65, don't yet qualify for Medicare, 1 in 4 Californians are uninsured. If you look at just 18 to 64, it's closer to 1 in 3. I'm a native of California. That number blows me away. Can you tell me that this long national nightmare is finally going to be over sometime soon?
Well, the important thing to remember about those statistics is all of those people are getting health care. They're getting it in a terribly inefficient way, and if they slip and fall or they get hit by a bus or they get H1N1 flu, they're going to hospital emergency rooms and we're winding up paying the bill.
Or they're going bankrupt trying to pay the bill.
That's exactly right. So the fact of the matter is that it's having a drain on society. The status quo is unsustainable. But what you said in the introduction about the Republican thrust here is exactly the conversation going on with wavering members of the House right now. We're saying to them, look, you are going to get beaten up on health care. whether you vote yes or no. The difference is if you vote no and this bill goes down, they're going to keep making stuff up about the bill.
Right.
At least if it passes, you'll be defending an actual thing that accomplishes things. And all of us have compromised a great deal from what we would have liked. I've talked to you 1,000 times of things I would have liked to have different. But that's what it comes down to, is whether or not we're going to allow more and more people to lose their health insurance. And I'll tell you something else where we got to fight. If you look at the last 10 years, incomes for people have been flat because every dime that employers have are going into health benefits.
Yeah.
So we're not getting any raises, and the economy is at a standstill because of it. So hopefully when we cast this vote, Saturday, Sunday, whenever it's going to be, we'll finally be on the road to solving this problem.
Saturday or Sunday, what can you tell us about the schedule, about what happens next, about what to watch for?
Well, I'm taking Siena plus 4 points in their first game, and I'm taking the Democrats plus 3 or 4. I don't know. I mean, the timing of it is, this is going to have to become public and visible and transparent for 72 hours according to our rules, which means probably tomorrow, the next day, we'll actually see the documents. Just to put it in some context, we hear a lot about how many pages the bill is. We're talking maybe another 100 pages to the 2,000 or so pages. They're relatively modest changes to the Senate bill, but they're important changes because the Senate bill did not do enough for affordability. We're going to add that. Doesn't close the donut hole. We're going to add that. And these things are going to get put together, and hopefully by Saturday, I don't know the exact timing of it, but we'll vote on it when it's ready.
Is there going to be anything in that, say, 100 pages, in those fixes, that are things that we haven't been told to expect? Do you think there are going to be any surprises? Is there anything still being negotiated at this point as to what goes in those fixes?
Well, I don't know how much is being negotiated, but there are some things that have been kind of below the surface of this debate. The Senate bill was written essentially by small state senators, and so it doesn't do nearly what it should for poor people. And in states like California and New York, where we have robust Medicaid programs, we have to make some changes. There are some things that have to be in it. We're not going to further scale back a woman's right to choose. That's not going to happen. Okay. I think that if we're going to add a public option, which is something we're still fighting for, we need to see the Senate do it. The House is already included in our bill. The Senate, in its amendments, I think is going to be the place that's going to get
I thought
added.
the House has to do it first before the
House has to initiate the bill, but there's nothing stopping the Senate from putting something in. There's nothing. We're in a very conventional legislative mode, actually. We now have bill. This bill can go back, and it can go to the Senate and come back. A lot of us are exasperated with some of the phoniness of the Senate. They're signing letters that say they want the public option. Durbin says, I'm going to whip the public option. And then they're pointing to Nancy Pelosi and says, what's your problem? The real problem is the Senate has to say, we want to take this up, and they haven't done so. But for the most part, the bill that the president described and the one that he talked about when he had the health care forum is the one we're going to consider. And it ain't perfect, but boy, is it better than the status quo.
You mentioned the issue of abortion. We've talked a lot on this show about Congressman Bart Stupak. We've raised the issue of how many people he actually seems to speak for. He says he speaks for a lot of people. We don't exactly know who those folks are. A lot of pro-life Democrats are now saying they can live with, strongly anti-abortion Democrats saying they can live with the Senate's restrictions on abortion funding, that they see it as not expanding federal funding for abortion in any way. Do you think that the Stupak threat to essentially hang health reform on this issue of abortion is over?
I don't know. Maybe he is going to vote no. Maybe he has some colleagues who are prepared to say we're going to deny health care for 35 million Americans. We're going to stop the rise of costs because we don't believe that simply banning abortions with public taxpayer dollars is enough. And look, I'm not happy about the Nelson language, and I think a lot of people should not be. Yeah. And I think that it is a marginal setback that we have to be concerned about. But one thing, a lot of us are over it, over this idea that 2 or 3 or 4 members of the House or Senate are holding the rest of the place hostage. And, unfortunately, Congressman Stupak, who's a friend of mine, is falling into that category. If you really can't get by the idea that we're going to have the Hyde Amendment, whether or not you vote for the thing or not, the restrictions are going to be there, and you're prepared to deny people in Michigan health care on the altar of some philosophical argument, then, there's nothing we can do to win their vote.
Yeah. It should also be noted that there's not a single abortion provider in all 33 counties that encompass his district. Congressman Anthony Weiner, it's great to have you here.
Thanks. Great to have you in Washington. Stay as long as I put anything you want on my tab.
Excellent. I have to go now. All right.